Everyone, today I'll be talking about Huntington's disease, or HD. HD is a serious inherited brain disorder that affects movement, thinking, and mood. The reason I chose this disease was that it really points out how one single genetic mutation can drastically alter normal physiology. In this presentation, I'll explain what HD is, how it develops, is diagnosed, treated, and any disparities in who gets it. Huntington's disease is a genetic neurodegenerative disorder. It causes progressive deterioration of nerve cells in the brain. Clinically, Huntington's disease presents with a triad of problems: uncontrolled jerky movements, cognitive decline, and psychiatric symptoms. Symptoms usually begin in mid-adulthood, around age 30 to 50. HD is ultimately fatal, and currently there is no cure for the disease. I chose HD because it points out very clearly the interconnection of genetics with physiology and shows how a defect in one gene can lead to far-reaching changes in the body. HD is a relatively rare disorder. It affects approximately 4 to 15 individuals per 100,000 among populations in European ancestry. In the United States, there are estimated to be approximately 41,000 symptomatic patients and many more at risk. I chose to focus on HD for this unit because the inheritance pattern is straightforward, and it impacts multiple physiological symptoms. The clear genetic etiology makes the concept of etiology easier to teach, and the diverse symptoms allow students to see how different body systems are affected. Early symptoms of HD can be psychiatric or cognitive. Anxiety, irritability, and memory problems may start. The hallmark symptom is chorea, which develops as the disease progresses. Chorea appears as involuntary dance-like movements of the arms, legs, face, or trunk. People with HD also have difficulty with coordination, speech, and swallowing. Over 10 to 25 years, thinking skills decline into dementia, and many patients lose weight and muscle mass. In advanced stages, HD resembles a combination of ALS, Parkinson's, and Alzheimer's. Life expectancy after symptom onset is about 15 to 20 years, sadly. HD principally affects the nervous system, especially deep structures of the brain. The most affected structure is the striatum, part of the basal ganglia. The striatum normally helps in maintaining movement and behavior. In its destruction by HD, patients develop chorea and behavioral changes. In time, other parts of the brain cortex and other basal ganglia circuits may also degenerate, leading to cognitive decline. In summary, HD is primarily a disease of the brain, but since the brain controls everything, multiple functions of the body are affected, such as movement, memory, and mood. HD is caused by a mutation in the HTT gene on chromosome 4. More specifically, there is an expansion of a DNA sequence, CAG. In normal people, about 20 CAG repeats are present, whereas in HD patients, there are 40 or more. This expanded repeat causes the Huntington protein to be abnormal. HD is an autosomal dominant condition, which means having just one copy of the mutated gene is enough to cause the disease. Any child of an affected parent, therefore, has a 50% risk of inheriting HD. About 10% of cases arise from new, de novo, mutations with no family history. The mutated Huntington protein misfolds and forms toxic inclusion bodies inside neurons. These clumps lead to neuronal dysfunction and death. The most vulnerable neurons are medium spiny GABAergic neurons in the striatum. When those die, inhibitory control in the brain is lost, causing excessive involuntary movements, or chorea. Other brain cells also suffer damage over time. Studies show that mutant protein is also disrupted Studies show that mutant protein also disrupts cell energy production and DNA repair. In short, cells slowly degenerate and the brain shrinks, especially in the basal ganglia, which explains the progressive symptoms. HD is diagnosed primarily through genetic testing. A blood test counts the number of CAG repeats in the HTT gene. If the repeat count exceeds the threshold for the disease, the diagnosis is confirmed, even before onset of symptoms. Before testing was available, physicians diagnosed HD by symptom pattern plus family history. We can now perform predictive testing in at-risk individuals. Clinical examination, including chorea, reflexes, and cognition, along with MRI, which demonstrates atrophy of the quadruped, supports the diagnosis, but genetic testing confirms it. There is no cure for HD. Treatment is about managing symptoms. The drug tetrabenazine is commonly used to reduce chorea and improve movement. Antipsychotic or antidepressant medications can help with mood and behavior. In addition, patients receive supportive therapies, physical therapy to maintain strength and balance, speech therapy for swallowing and communication, and nutritional support to combat weight loss. Occupational therapy helps adapt daily activities. Researchers are also testing novel treatments, such as gene slicing antisense oligonucleotides, which aim at lowering mutant huntingtin levels. HD does not affect all groups equally. It is most frequent in people of European ancestry, about 5 to 10 per 100,000, and much rarer in East Asian populations. Because of this, HD might be under-recognized or underdiagnosed in non-European ethnic groups. There is no known gender difference. Men and women bear equal risk genetically. However, access to care can vary. Access to genetic testing and specialized care is easier and more affordable for families with higher incomes or education. In contrast, low-income or rural patients might face delays in diagnosis and treatment. Awareness and resources from support organizations may not be evenly available across regions. While exercise cannot halt HD, it extends the period in which HD patients remain active. Accordingly, physicians and therapists advise regular, low-impact exercises such as walking, swimming, and the stationary bike, along with strength training to enhance balance and stamina. Stretching and core exercises keep flexibility. Some patients benefit from dancing classes or yoga. Speech therapy exercises can improve swallowing and communication. Overall, an active life may improve mood and overall quality of life. Encouragingly, structured exercise programs have been shown in some studies to slow decline in motor function. It is pertinent that HD patients keep themselves physically active to manage their symptoms as part of the care plan. Huntington's disease is a hereditary neurodegenerative disorder of the basal ganglia in the brain, characterized by motor, cognitive, and psychiatric features. Symptoms include chorea, dementia, and changes in mood, typically beginning in mid-adulthood. A dominant CAG repeat expansion in the HTT gene is the cause of this disease. Any person carrying the mutation with 40+ repeats will develop HD. Though there is no cure, symptoms can be managed and quality of life improved through treatments such as medications, therapy, and exercise. Thank you for listening. Here are my sources. Have a good day.